Hi, I'm Dr. Akshita Torgal, a practicing physiotherapist. On the occasion of Women's Day, I would like to discuss some typical health issues that most women face and suffer in silence. Millions of women suffer with issues such as urinary incontinence, where there can be leakage of urine when sneezing, coughing, laughing, exercising, or even jogging. This can be very inconvenient and pretty embarrassing at times. Some women have increased frequency, urgency, or retention of urine despite having negative UTI test. Some women suffer from fecal incontinence, while some may have pain, pressure in the pelvic area due to prolapse of important pelvic organs, where an organ drops down from its normal place. Some women also experience lack of sexual appreciation or pain with intercourse, affecting the overall quality of life. All these symptoms usually occur due to improper functioning of a group of muscles that surround the female parts, called the pelvic floor muscles. Now, who are the women that are most affected? Women after childbirth. It does not matter if it's a natural or C-section. The pelvic floor is affected either ways because of the childbearing stress. Pregnant women who bear a lot of pressure on the pelvic muscles due to increased size of the uterus and belly. Menopausal women with hormonal imbalances. Decrease in the amount of estrogen can impact the elasticity of the pelvic floor in a big way. High impact athletes or women in sports. Women whose lifestyle or profession demands a lot of physical activities. Women doing weightlifting or women who play wind instruments. Women who had abdominal surgeries, surgeries of the uterus such as hysterectomy, low back or hip surgeries. Women who have fractured their spine, pelvis or tailbone. Women with gynecological issues such as endometriosis, vulvodynia, interstitial cystitis or vaginismus. Now, before I get into the possible solution, let me quickly explain what a pelvic floor is. This is a female pelvis, and what you see here in red are the muscles of the pelvic floor. They are formed in 3 layers and they form a sling-like structure supporting some of the very important internal organs such as your uterus, urinary bladder, colon and rectum. These muscles not only support these organs but they also contract and relax to control the urine flow and bowel movement. The pelvic alignment directly impacts the function of the pelvic floor. So the appropriate functioning of the muscles and the joints around the pelvis such as low back, abdominals, hip joint, SI joint and pubic symphysis is very important for pelvic floor activity. Now you can imagine a pregnant woman with weak abdominal muscles putting a tension on the pelvic floor. She may also have low back pain stressing the pelvic floor, hormonal imbalances undermining the strength of the pelvic floor, pressure of the enlarged uterus on the pelvic floor, plus the gravity pulling down on the pelvic floor. All this can be taxing to the pelvic floor even before the birth of the baby. On top of this, birthing trauma is added to the pelvic floor. Just imagine the plight of the poor pelvic floor. Now that you know the basic structure of the pelvic floor, here are some ways in which your pelvic floor muscles can get affected. Tight or hypertonic pelvic floor. For example, athletes or women who lift heavy weights tend to carry the tension in their pelvic floor to perform high impact activities. Weak or hypotonic pelvic floor. For example, a woman in her post-pregnancy stage. Some women may have a combination of both tight and weak pelvic floor, such as women with perineal tears may have tight spots from stitches and scars and also have weakness from the childbirth. The most common method adopted by women to strengthen their pelvic floor is by performing an exercise called Kegels. It involves contraction and relaxation of pelvic floor muscles as if you're stopping the flow of urine. I have a lot of patients who tell me that they have been performing Kegels for years together and do not see any significant change, or sometimes even end up having increased pain or symptoms. The 2 possible reasons for this are that sometimes Kegels is not applicable for your specific condition or the patient is not doing it the right way. Please do not perform Kegels if you have internal pelvic pain or increased urinary frequency. This pain is mainly because of tight or hypertonic pelvic floor muscles and not weakness. Doing Kegels in this situation will actually tighten the muscles even more and cause more pain. In this scenario, it is actually important to perform a pelvic relaxation program, manual release techniques, alignment correction, biofeedback, or pain modalities to relieve these symptoms by your physiotherapist. Once you're pain-free and have achieved pelvic floor relaxation, that's when starting a Kegels exercise program will help you regain strength and elasticity of pelvic floor muscles. It is also important to perform Kegels correctly. I would like to give 5 important tips for performing Kegels in the right manner. First, stretching. It is a good idea to stretch your hip, leg and low back muscles prior to starting Kegels because tightness of these muscles can refer the pain or trigger points to the pelvic floor muscles and can also affect the contraction of the pelvic floor. Here are some useful stretches that I would like to show all of you. Inner thigh or adductor stretch. Internal rotator stretch of the hip, stretching your external rotator of your hip. Stretching the front of your thigh or the hip flexor. Stretching the back of your thigh or your hamstrings. Stretching your abdominals. Here I would like to add a note of caution. Please do not do an abdominal stretch if you had a C-section or if you have a condition called as diastasis recti where there is separation of the abdominal wall. Some more stretches would be double knee stretch and low back stretch. Second tip, good posture. It is important to assume a good posture while performing Kegels. Many perform Kegels in a bad or slouched posture. Bad posture may not give desired results. It is very important to maintain a neutral position of the neck where it is not protruded or extended. Your shoulder pushed back or retracted. No forward bend or kyphosis at the upper back or lower back. And your pelvis should be maintained in a neutral position where it is not tilted forwards or backwards. Only a correct posture can optimally activate the pelvic floor. Third tip, lift the muscles. It is also very important to lift up the pelvic floor muscles when you contract or squeeze, as if in an elevator going from the first floor to the second one, because lifting up helps to bring the muscle fibers together and builds up the needed strength and elasticity. Fourth tip, do not perform Kegels every time you urinate. Performing Kegels by holding urine flow is a very good technique to know and recognize the right pelvic floor muscles only in the initial stages. But doing Kegels exercise every time you urinate can lead to incomplete emptying of the bladder, increasing the risk of UTI. It can also send confusing signals to your brain. Last and the most important tip is to not hold your breath during Kegels. In fact, using appropriate breathing pattern along with Kegels is extremely crucial for gaining pelvic floor strength, as there is a close connection between your breathing muscle or the diaphragm and the pelvic floor. The best way is to inhale first, which relaxes or lengthens the pelvic floor, and then perform Kegels as you exhale. During exhalation, the pelvic floor muscles move up and come together for toning and strengthening effect. You can start Kegels with a 3 to 5 second contraction to 10 seconds relaxation, and then eventually progress to 10 seconds contraction and 10 seconds relaxation. You can also add fast Kegels with 2 to 3 second contraction and 2 to 3 seconds relaxation. Perform 30 to 50 repetitions a day for 8 weeks in a spaced out manner, around 3 to 4 times a day. It takes up to 8 weeks to build up the normal tone and strength, so perform them regularly and patiently. You can also perform Kegels in sitting, hook lying or side lying positions. You can add hip rotations, heel slides, standing to squatting, small jumps, ball squeezes, dance format, functional activities, and many other variations or progressions as you get more comfortable with the basic Kegels. Once again, I would like to emphasize, do not neglect any pelvic pain, weakness, incontinence, or any other symptoms. Do not suffer in silence due to embarrassment to discuss this with your healthcare provider. Please seek help to diagnose and treat your condition. It is always a good idea to consult a physio specialized in women's health before starting any exercise program on your own. Kegels is not as beneficial unless accompanied with core, back, and hip strengthening programs. So friends, take charge of your pelvic health, get back in shape, and renew the queen in you. I hope you liked this video. Please feel free to ask any follow-up questions. Your comments are always welcome. If you like this video, please share it with all your friends. Thank you and wish you a happy Women's Day once again.